Hi, I'm Janak Goyal, and in this presentation I will talk about pulse echo imaging. The continuous sound cannot make anatomical images, hence pulse echo imaging is used to achieve this goal of creating anatomical images. The short pulses of sound are transmitted to create an anatomical image. The commonly used term PRF stands for pulse repetition frequency, which is the number of pulses per second. The ultrasound image is created by processing echoes received from the body tissues. Echoes are generated by reflection of sound from the tissue boundaries or interfaces. The echo strength depends on the strength of transmitted signal, angle of incidence of the sound beam, and the impedance difference at the interface of two tissues. The sound beam should fall on the tissue interface at 90 degrees for maximum reflection. The tissue interface is a very important concept which determines the amount of reflection. The reflection of sound from the tissue interface depends upon the difference of impedance of the two tissues at the interface. The greater the impedance difference and the greater the reflection. The impedance is the product of density of the medium and the speed of sound in the medium. Let's look into the body tissues. Most of the body tissues are made of specific tissue parenchyma and a supporting connective tissue framework, creating multiple connective tissue and parenchyma boundaries, so-called interfaces. The tissues have different histological and sonographic characteristics based on the arrangements of connective tissue framework and the parenchyma. Tensons appear bright because they have densely packed fibers and multiple interfaces to reflect sound. On the other hand, the body fluids appear dark because they have no connective tissue framework, hence have no interfaces to reflect sound. The arrangement of different tissues in the body creates tissue interfaces. Let's look into the amount of reflection from these tissue interfaces. The reflection of sound differs based on the difference of impedance of the two tissues at the interface. Larger the difference, larger the reflections. Normally, less than 1% of the sound is reflected from most of the tissue interfaces, and the rest is transmitted to the deeper tissues. 99% of the sound is reflected from the tissue air interface, and about 50% of the sound will be reflected from the soft tissue bone interface due to a larger difference in the impedance. Let's look at another concept in ultrasound imaging, so-called attenuation. Attenuation is a progressive weakening of a signal as it travels to the deeper tissue, and it depends upon the medium of travel, which is your tissues, and the frequency of transmitted sound and the depth of the tissues. The attenuation is measured in decibels. Although different tissues attenuate sound at different rate, but ultrasound machine is programmed to calculate attenuation in the soft tissues based on half a decibel per megahertz per centimeter. Here are some differences in the attenuation of sound with the different body tissues. Water has no noticeable attenuation of sound with frequencies less than 10 megahertz. Biologic liquids attenuate sound far less than the soft tissues. Attenuation in blood is equal to that of soft tissues, and the air has an extremely high attenuation rate as compared to the soft tissues. Lung attenuates more sound than the soft tissues due to the scattering of the sound. Bone has a high attenuation rate due to absorption. The attenuation in the muscle depends upon the orientation of the sound beam with respect to the muscle fibers. As opposed to attenuation, compensation is an amplification of sound. Compensation is variable amplification to compensate for increased attenuation of sound with increased depth. The ultrasound system calculates the attenuation based on the depth of origin of the echo and applies amplification based on calculated attenuation. Echoes from deeper tissues are amplified more than the echoes from superficial tissues to compensate for their loss. The compensation is also known as time gain compensation, or TGC, or depth gain compensation, or DGC, and also swept gain.